So I thought I'd start today with a little bit of comic relief. Those of you that have toddlers, you can probably relate to that. A little bit of a drama king or queen. I can't really tell the sex of that little one, but anyway. So toddlers. We're going to talk about growth and development of toddlers. And I'm going to go through the PowerPoint first because it's a little out of order as to the chapter in the book. And I'm sorry about that. I didn't really realize it until a little bit ago. So let's go through the PowerPoint and then we'll go through the book and I'll show you all of those good tables and boxes that you need to be aware of. All right, so with a toddler, so with an infant, you've got this really rapid period of growth, and then with a toddler, it slows down just a little bit, okay? They get about half of their adult height by age 2. Their average weight gain is about 3 or 4 pounds a year, and then you can see their height there. Anterior fontanelle closes by about 18 months. The posterior fontanelle, we didn't talk about this during infant development, but that usually closes about 4 months, 2 to 4 months. So your head size in a toddler is a little bit more proportional to the body. As they get, to that toddler / preschool age, they kind of grow into their head. So, organ system maturation. So there's some changes in each one of the organ systems. It's summarized nicely here in these 2 slides, and there's a little bit more information in the text, but this kind of summarizes it. The brain gets about 90% of the adult size by age 2, and again, your fontanelle, your anterior fontanelle stays open to allow that brain growth, and then it closes by age 2. It should be well closed. Respiratory system, trachea is still small, but not as small as an infant, so they can handle a little bit more secretions, but not much. They are not obligatory nose breathers now, so they can breathe through their mouth. Heart rate goes down, blood pressure goes up. GI system, they have less frequent stools. They don't have bowel movements every time they eat, usually, as they get closer to that preschool age. Bladder, kidney function. You're doing toilet training in this age group too, so they do learn a little bit of control with that. Musculoskeletal, their bones grow longer. Their muscles as they walk, they develop their muscles more, so their muscles get bigger. We tell them they have big muscles. They do have bigger muscles. All right, the 2 developmental theories that you need to know in the toddler age range are Erikson and Piaget. Erikson is another specific autonomy versus shame and doubt. Okay, and there's the activities on the right there. Piaget the toddler age kind of spans 2 stages, the sensory motor and the pre-operational. And there's a chart in the book that breaks down like the sub-stages, and I'll show you where that is. That's good information. Freud, don't worry about Freud. All right, some motor skill development in a toddler. The gross motor, we talk about gross motor. We talk about fine motor. We'll talk about speech. We'll talk about sensory development. So gross motor, they learn to walk. That's the big thing during the toddler period. They start with this big, wide toddler gait, and they just kind of waddle, and it looks like they're going to fall over every time that they take a step. But later on, as they walk a little bit, they get a little bit more stable. Now, one of the things, red flag, is if they're not walking by, close to the 2-year-old age, really earlier than that. 12 to 15 months is when they should start walking. So if they're not walking by that, then a red flag should be raised. Fine motor skills, they do learn like how to hold utensils. They can work puzzles. Unfortunately, they can use a touch screen. They can probably text somebody pretty easily nowadays with the iPhones and tablets. Speech development, you can read through the different kinds of languages there. There is a table in the book that talks about words and speech sentence length, so we'll go over that. Echolalia, so they repeat. They're mockingbirds. All right, sensory development. They are exploring all 5 senses, including taste. Everything goes in their mouth. Their visual acuity tends to get a little bit better. It's like 20/50, 20/40 by the end of this age range. Usually what I kind of keep in my head is when they go into school, like kindergarten, 5, 6, 20/20. That's the best their vision's ever going to be, is when they enter school. If they don't have any kind of visual impairments. Hearing, likely to be at adult levels. This is where they develop those, like a little friend of mine, the tag in the back of his shirt was silky, so that's how he put himself to sleep. He played with those textures. My daughter, I'm going to tell on her, she had a silky, and so she had a piece of like silk pajama that she had to go to sleep with, rubbing those between her fingers. So I think she still has that silky. She's like 26. Emotional and social development of the toddler. Separation anxiety is big. Not separation anxiety. Separation, like separating themselves as a different person. They focus on themselves. It is all about me at this age. Some typical behaviors you'll see. They know the difference between boys and girls towards the end of this stage. They can develop a temper. You hear the terrible twos. So it's kind of a real thing most of the time. They learn how to get reactions out of people. So as you can see by that little one throwing a fit when his mom watched. So they know how to push people's buttons at this point. May show fear. They get scared. They get scared of the dark. They get scared of strangers, which is a good thing sometimes. May resist invasive procedures, you think. That's probably something in every age group. All right, so some age-appropriate developmental tasks. And the next slide talks about how you can promote the growth and development of toddler through play. A lot of times in the hospital, this is how we keep them on track with their growth and development. Okay, it's the major socializing thing at this age. It's how they communicate with other kiddos. Usually they have parallel play at this age range, or at this age. They play alongside other kids, but not with other kids. So you'll see them, sometimes they're even playing the same thing, but they won't interact. It's not a cooperative play. It's more parallel play. Short attention span, yep. The toys that you want to introduce are ones that have sensory, like touch, different textures. You've seen those walls with like the buttons and the latches and things like that on Pinterest, or I have. They'll make a wall with all these kind of things that increase your fine motor skills. So that's one thing to focus on. All right, we're going to skip the questions there. But when you introduce all of these toys, you have to think about safety as well. So choking hazards, anything with small buttons that might come off, those aren't a good idea. Anything with parts that might break off and they can put in their mouth, because again, they're exploring all of those senses and everything goes in their mouth. They may be teething at this point too, like there's molars, so they want to chew on things. So just be aware of that. Okay. Car seat safety. There's some good car seat information posted in the infant growth and development, and you can use that information in the toddler stage as well. Secondhand smoke, water injury, water safety. Drownings are huge. Cook Children's does a really nice job of promoting water safety. I'll see if I can post one of those links to their water safety information. Poisoning, because again, everything goes in their mouth. They're very exploratory at this age, so you want to keep all your cleaners locked up. Don't put them in a high locked cabinet, because if they see you put something up there that looks very enticing, they're climbers too, towards the 2.5, 3-year-old stage. So they may go after that. So low locked cabinet. How much sleep do they need? Well, An 18-month-old to a 24-month-old usually needs about 13 hours. As they get older, their need for sleep decreases until they get to be teenagers. And their need for sleep actually increases, but their actual sleep sometimes does not. Napping, they still nap during this stage. Usually the preschool age is where the naps go away. All right, safety during mealtime. Again, with your foods, with your choking hazard, make sure everything is cut up in pieces that aren't too large, but not too small to choke on as well. That did not make any sense. I'm sorry. Grapes, make sure you cut them in half. Hot dogs, cut them in smaller pieces. Those are two that I can think of right off the top of my head that if they're screaming and yelling and they take a big breath in and they've got a piece of hot dog in their mouth, then that could be bad news. So make sure you cut up your food and avoid choking hazards while you're feeding. All right, so toddler nutrition. Toddlers go through this thing. It's almost like a anorexia. They don't want to eat. They get very, very picky. So what parents can do and what you can teach parents is don't stop offering those veggies. Don't give in to those picky little things. Make sure you offer veggies, fruits, before sweets. Important because this is a game changer. Okay, this changes the way they eat the whole rest of their life. If they eat macaroni and cheese and corn dogs at this age, and that's what parents feed them every meal, then guess what? They're going to continue to only eat that. Fruits and vegetables, consistently have parents offer those. They do learn to eat by themselves. It's not always pretty, but they do learn at this stage to self-feed. Some questions are often asked about bottles. They should be on a cup if they're a year old. So encourage that. Do some parent teaching. Pacifiers, we'll talk about pacifiers and thumb sucking over in the chapter, but when their permanent teeth start to come in, that's when you worry about, dental things with pacifiers and thumb sucking. But bottles, definitely by a year, we should be on a cup. Some common developmental concerns of the toddler, of course, potty training, of course, temper tantrums. Oh, goodness, you'll get them. Thumb-sucking pacifiers, we talked about that. Sibling rivalry, if a new baby is born, there's sometimes some regression that occurs. Like if they were potty trained and then mom has a new baby, then sometimes they become not potty trained anymore. So those are some developmental concerns. Are they abnormal? Absolutely not. They are totally normal, but parents need to be aware that this might happen and this is how you handle it. All right, so potty training. Potty training is kind of all over the map how old is good for potty training. Some kids are potty trained as young as like 18 months, 19 months. Some are 3.5 years. And I use those parameters because those are my kids. My daughter was very easy. She was 18 months, no problems whatsoever. My son was 3.5. So there's no magic number. You just have to kind of assess their readiness. If they're having regular bowel movements, then it might be time to start that pattern, that periodic. Let's go to the potty and let's see what happens. If diaper's not always wet, if they wake up in the morning and they're dry, that's a good sign. If they will sit down on the potty and sit there, that's a good sign. If they can physically pull up and down their pants, then that's a good sign. Of course, they will need to be able to walk well in order to be successful. All right, some sibling rivalry things. When I talked about if new baby comes along, you just need to kind of carve out some time for toddler. Let them help take care of the baby. Make them know that they're the big brother or big sister. So just kind of make their role important. Discipline. Okay, so again, this is one of those things like nutrition. This is going to shape how they act in the future. So set your limits. Spanking usually doesn't work very well at this age. Timeouts, those work a lot better. Sitting in the sad seat, that's one that I've heard. Chair in the corner. Make sure you enforce it. Don't give in. Stay firm. Set your limits. Those are all important focuses for discipline of the toddler. And this is not just information from me to you for you to use, but this is information to share with your parents as well. Because your parents are the first teachers. They do what they see their parents do. So they are very, I can't think of the right word right now, but they do, monkey see, monkey do. How's that? They do what they see done at home. They speak like they hear at home. They react to things like their parents react. So another important teaching tip for your parents. All right, and so at this age, a lot of times you think about preschool towards the end of this stage. So here's some things that you need to look for, or you need to teach parents to look for when they're looking at a preschool. You need to make sure the kiddo's ready, okay? So you may just start slow, start with a morning, or start with a couple hour visit to daycare, to preschool, and then go up from there. Make sure that everything in the preschool is, state certified, CPR, etc. Parents can come anytime. Now they have the daycares and the preschools with the cameras that you can watch the kids online. That's fabulous. And make sure, of course, it's clean and child-proof, etc. All right, so let's go over to the chapter. And again, it's a little bit different order than PowerPoint. The first part here talks about physical growth. And there it is. Their height and weight continue to increase, but not at the rate of an infant. Okay. Anterior fontanelle should close about 18 months. Remember that. Okay. Organ system maturation. I like the slides because they are concise, but there's a lot of good more information over here, so you can read through that. One thing about the respiratory system, their ear canals are still kind of short and straight, so ear infections can be still pretty common in this age group. Blood pressure goes up, heart rate goes down. Muscles get bigger. Okay, so let's talk a little bit about psychosocial development. Let me get this up here so it's better. There we go. Erickson's. You need to know your Erickson's and know your Piaget. Okay, and I think by the end of your developmental assignment, you will know that. Here is the chart that I was talking about that breaks down the sensory motor and the pre-operational right here. You only have about a year of pre-operational in the toddler age range. A toddler is officially classified from 1 to 3. And then you can ignore Freud. Don't ignore him, but we're not going to spend a lot of time on him. All right, gross motor skills. We talked about walking. We talked about fine motor skills. Toys that encourage fine motor skills are puzzles. Anything that encourages that pincer grasp and using more, less hand, more fingers. Those are all good toys. There's a picture of that's toddler gait right there. That wide, oh my gosh, I'm going to fall gait. Here's some motor skill development. This would be a wonderful chart to look over and learn. All right, their sensory development, again with the vision 2050, 2040, by the time they get to school, 2020. So you're just going to kind of progress towards that. All right, language development. This is the chart that I was talking about. It talks about sentences, how many words they should have. Again, great information. You can use this information to complete your developmental assignments, but it's also nice to know information for, I don't know, maybe an exam. All right, if you're going to, one thing during the toddler age, since their vocabulary is like exploding, like by the time they're 3, they should know like 1,000 words. This is a great time if you're going to introduce another language to do that. Emotional and social development, again, we'll talk about play, parallel play, temper tantrums. They know how to get a reaction out of people, so they can sometimes throw temper tantrums. Again, important to enforce discipline. Be very firm. Let's see. Nurse's role. Now, the importance of a medical home comes into play again, because you would like to see progression in a normal fashion in their growth and development. If you notice something that is, they're regressing or they're not developing like they should, then it can be addressed. If a patient or a family kind of hops around and nobody really does a well child check anytime, or they don't do a developmental assessment every so often, then those kids may fall through the cracks. So real important for nurses to assess growth and development, where they should be, and if they're not where they should be, to get something done about it. ECI is a resource that early childhood intervention, and I think it goes up to, I used to know the ages, but I think it's age 3, that they will come in and they will do an assessment if there's a concern, and they will provide therapy, speech therapy or physical therapy or occupational therapy with a toddler if there's a deficit identified. So ECI is a cool thing if parents know about it. Here's some nursing diagnosis that might be present in that toddler age with the parents or this child. Of course, risk for injury. Okay, some signs of developmental delay. Again, if you see a red flag, these are some things that should raise a red flag. If they frequently fall, or if they walk well for a while and then they start to fall, that's a huge red flag. The speech, if they don't speak, that's another huge red flag. So a good assessment every time that you see these kids is key. This talks about parallel play. These kids are parallel playing. They're not really playing with each other, but they're just kind of playing by each other. Language development. Reading is good for toddlers. Even if you know that they're not reading, they see that you're opening the book, they see the words, and they put the story with that. So early readers are read to. Appropriate toys. Oh, great box. Great information right there. Talks about encouraging reading. Oh, one of my favorite books. Here's some tips for reading with young kids. And then talking about choosing a preschool. We talked about that. Car seat safety. Again, refer to that information in your infant growth and development. Avoiding exposure to tobacco smoke. It's secondhand smoke. It still irritates those ear canals, and it can increase the incidence of ear infections. Also, all that tar, and it can cause lung damage as well. Asthmatic children, absolutely, please teach parents not to expose them to secondhand smoke. Now, if they say, "Oh, I go outside and smoke," you still bring all of that smell and that stuff back in on your clothes. So that's not an out. Car seat, proper car seat installation. I know most of the children's hospitals do car seat checks every once in a while. So if you have a parent that has a new baby, or, well, we're not talking about infants now, but you can provide that information to them. I'm sure that it's available at the hospital about car seat checks and things like that. It's very important that car seats be properly installed in cars. All right, these little dots right here, this is great information, okay? It's just some general preventing injury stuff for kids. Lots of stuff that you can use for parent teaching. So Lock the doors. Keep the pot handles turned inward. Some of it's a no-brainer. Okay, firearms, keep them locked up. Watching for cars. You know, those are heartbreaking stories about 2- and 3-year-olds that run out in front of cars just because they don't know. So make sure they stay away from unknown animals and even known animals. I mean, we've had family dogs attack kiddos too. So good teaching tips right there. Potential poisons, of course, meds, cleaning products, antifreeze, anything that's petrol, kerosene, lamp oil, that causes some serious damage. So make sure you keep all that locked up. Some more safety measures. Good teaching. Button batteries. Button batteries and magnets. Those little magnets. We had one that came in that put one up his nose. Well, there were 2, and they were on each side of his septum. So he had put them up his nose, and they had stuck together, and they were so far up there that they couldn't get them out. So they had to like go do sedation and go up there and get them out. So button batteries, magnets, anything like that. Bad news. Again, with the water safety, make sure that you always have somebody dedicated to watch kids all the time. They can drown in just inches of water. So please preach this to your parents. Summertime, we see such an increase in drownings and near drownings. It's heartbreaking. There's some teaching tips for drowning. And it talks a little bit about nutrition. Breastfeeding, weaning. AAP recommends that you breastfeed up until age 1 or 12 months. The international age of weaning, just because of the scarcity of food in third world countries, used to be, I don't know what it is now, but it used to be age 4. So just kind of keep that in mind, that if we wean at a year, but there are places in the world that breastfeed their kids until age 4 just because that's the most nutritious thing that they have. Cups by about a year. Okay. Dental visits. I think it talks a little bit about dental visits down here. Dental visits should start at a year with just a screening and maybe like a little cleaning. Brushing their teeth should start even earlier than that. You can brush it with like a little washcloth as soon as they get teeth. All right, the whole juice thing. I know that the new recommendation is no juice, which works for me. Juice has a lot of sugar in it. It can affect the teeth. It can affect the weight. So it says limited to 4 to 6 ounces per day, and I think that is probably pretty liberal according to the new recommendations. Milk should be about 16 to 24 ounces a day, and at this stage in the game, it should be full-fat milk. Okay, no 2% until age 2. They need that fat for brain growth. Okay. Here's some choking hazard information you can share with your parents. As far as advancing solid foods, continue to offer veggies. Okay, veggies more than fruits. They get that anorexia, that toddler anorexia. Okay, their appetite, you may think, oh my gosh, my child is not eating a thing, but they'll eat when they're hungry, and they'll get what they need. All right, here's some information you might share about picky eaters. Make sure they're getting their calcium. You have kids that are allergic to milk. You have kids that just absolutely will not drink milk. So make sure they're getting their potassium, or their calcium in some other form. If they're not meat eaters, make sure you use iron fortified everything. Okay. Preventing overweight and obesity. So we start monitoring BMIs during this age. BMIs need to be done at age 2 and assessed every well visit from them. Plotting them on the growth chart, you can see trends, both good and bad. If you see a trend downward, then you might want to do a little bit better nutritional assessment. If you see a trending upward, then you might need to do some teaching as far as good nutrition. All right, here's a little study that talks about preventing overweight in U.S. kindergartners. Oh gosh. Type 2 diabetes usually doesn't happen at this age, but it's becoming not adult onset anymore. You know, you see teenagers, you see 10 and 11-year-olds diagnosed with it. So now's the point where we're going to teach them the good eating habits that might prevent that later. And sleep, we talked about how much sleep they need. They need about 13 hours on the average there. And that number goes down as their age goes up until they get to be teenagers. Healthy teeth and gums, like I said, they go to the dentist, need to go to the dentist about age 1. Fluoride, it's good to know, or it's good for your parents to know if the water in their community is fluoridated. If it's not fluoridated, then they may need some fluoride supplements. If it is, most incorporated areas are fluoridated water. I think I'm saying that correct. They won't need any kind of fluoride supplement. But in order to prevent cavities, which is a huge problem in kids, dental visits, I would recommend some like sealant things, just because they've always worked for us. That's nowhere in your text. That's freebie. Low sugar foods, lots of water, cut down on the juice, and then fluoride supplements if there's no fluoride in the water. And then I think the last thing it talks about is discipline. Again, we said spanking doesn't really work. Unfortunately, it happens, but more a consequence of their behavior. And also, when you talk to toddlers, don't tell them what they shouldn't do. Tell them what they need to do. And I used to think that this was crazy, but if you hear a parent going, use your words, or something positive, that changes their behavior. They don't do the negative behavior because they're doing the positive behavior that their parent told them to do. So think about that when you're disciplining your own kids and when you're teaching your parents. All right, and then here's some providing toddlers with guidance and toddlers' parents. We talked about toilet training. Here's some things that might indicate that they're ready. Oh, naked baby pictures. Toddlers can have a lot of negativism. No, it's their favorite word. Okay, so just know that that is not abnormal, but how parents react to that can make or break them. Temper tantrums, yeah, that happens. Here's some information on thumb sucking and pacifiers. Again, really not an issue until the permanent teeth come in. Then you need to really think about that. Now, I know you don't want a 4-year-old walking around with pacifiers, so the earlier the better. But it becomes an issue when permanent teeth start coming in. And there's a cute baby picture, and it talks about regression that might happen when a toddler has a new baby brother or sister. All right, here's our wonderful care plan. Has some interventions about injury prevention and nutrition and sleep and growth and development. So important to go through this information and, of course, your key concepts. And after the references, there's the worksheet. All right, so that's all I have on our lovely toddlers. You all have a nice evening.